Hi, good evening. Welcome to another episode of Let's Talk About Mental Health. I'm Nels Kloster. I'm an addiction psychiatrist working in Southern Vermont.
And I'm Robert Stack. I'm a licensed mental health counselor.
Yeah. And tonight we have a guest on our show, Mark Ames, who is the coordinator for a statewide network called the Vermont Recovery Network. Welcome, Mark.
Well, thank you. Thank you for inviting me here.
Oh, you're welcome. And I just want to mention, last week we did the show. Actually, we did a couple shows last week, and I hope you all enjoyed it. We enjoyed doing it. And one of the things I wanted to mention is that recently we went up to White River Junction. I think we talked about it on the show. We went up north to do a training program for coaches. And we did it up there with the idea of they had coaches for opiate, medication-assisted coaches. Is that right? Is that how to say it?
Yeah, medication-assisted therapy.
And so from that, we talked with Mark a little bit and invited him down to be on the show. And one of the things that we wanted to focus on was this idea of recovery. And you know, the recovery from mental health, recovery from addiction. And it's not just about being in treatment. It's really about recovery. And Mark reminded me that years ago, I don't know, 6, 7 years ago, 8 years ago, I don't know when it was, but I went up to White River and did a talk on this idea that one of the ways to think about getting people into recovery is this sort of combination between stages of change and motivational interviewing. And you've heard me talk about this, but so a lot of people may come in and they're curious and they need help with one thing or they need help with another. And one of the things that you sort of do is try to identify, you know, what are they taking action for? And maybe there's some things they're not even aware of. Maybe there's some things that they're just thinking about. Maybe there's some things that they're already doing. And so, and I noticed this when I went on the website, to the recovery website, you talk about this. You know, where is the client when they walk in the door? What are their concerns? And how can you help them? And that really struck me, that little talk that I gave sort of carried on. Because it's that idea. Somebody comes in, they have an idea of what they want or something that they're looking for. And, you know, with the right questions, with the right approach, you can find out, you know, exactly, you know, what it is that they want different in their life. What are they ready to do? What are they thinking about doing? And you can use some motivational interviewing techniques to sort of lead them, if you will, or help them find the answer that they're looking for, without being, you know, telling people what to do. Yeah. So I'm happy to see that on the website, and I'm happy to have you here. Thank you.
Yeah, and one of the things I liked about the recovery networks is it's often seemed that ideas about recovery are kind of polarized. That it's sort of, some folks are the old-fashioned 12 steps are the only way, you know, AA or NA is recovery. And then at the other end of the spectrum, folks with a very heavy reliance on medications, you know, these medication-assisted therapies with methadone and Suboxone. And it struck me that the recovery networks were a great way of sort of mediating this culture clash. That it's neither one nor the other, but there's a place for all of these. And there's, again, with the recovery networks, a lot of interesting space in between.
Well, you know, when we started the recovery centers, they were started with state funds. I worked for the state years ago, and when the centers were funded, you can't fund AA. AA is not affiliated with any other organization, so we had to have some way to provide support for people no matter what their approach to recovery was. The work that we did in trying to figure out how to do that is part of what Robert's talking about helping us think about where somebody is in the stages of change. One of the important things that was a learning from the original trainings that Robert did was that many times people will go up to somebody and say, you know, what you need to do is this. Well, if there's anything that the addicted community doesn't do well, it's take advice. I think that instructions are not really terribly successful. And the idea that if somebody is in pre-contemplation for changing their life, trying to tell them what they need to do to change their life is just not working. It's one of the reasons so many people fail at treatment. They're not ready. They're not ready to go to treatment and learn what they could learn there. They waste perfectly wonderful experiences because they're not interested in getting the benefit of it. And I think the learning from this whole idea of the stages of change was that you need to meet people where they are and try to do the next right thing with them. Probably the archetypal question that recovery workers ask people is, how's that working for you?
Right.
Yeah. Well, and really, I think, I forget if you said this on the show, but I think you put it very nicely in other conversations that this idea of recovery doesn't start with your first day of not using. That recovery is more than just sort of a countdown of how many days you've gone without drug use, but refers to this process of when you first sort of entered into the path of improving your life because of some kind of pain, some kind of discomfort that finally has you, at least if not talking about a drug problem, you're addressing the quality of your life and say, I've got to make some changes. And what a shame if we would sort of bar the door to people just because they're not saying, I've got a drug problem or I'm an addict, help me, but rather coming in by some other means, for some other reason.
And you know, years ago there was a program that used to talk about entering treatment through any door, and that was one of the ways. And I think that's one of the things about recovery centers is that you'll have people go in there before they go to treatment. I mean, quite frankly, you know, before they even enter any kind of professional treatment or counselors or medication or anything, you may have people going there just saying, you know, I hear that you can help, or you'll have family members going there saying, you know, I have a loved one who's sick, someone who's using, where do we go from here, what's available, how do I get them into treatment, or something like that. And so, and then, but you also have, on the other side, you have people coming out of treatment going to recovery centers. I mean, I talked about this before, but there's this transitional period between when you go from alcohol and drug use community, if you will, and you go into the recovery community, and you get into living with people who are clean and sober activities. And it's that transitional period that is so difficult for most folks. I mean, you know, you can go to treatment for 2 weeks or 1 week, or you can go to outpatient for 6 hours, you can go to the clinic and get medicine, I mean, whatever you want to do, but then there's the whole rest of the day. There's the whole rest of your life, and I think that's one of the places where recovery centers can be so helpful. By the way, for folks there, to be clear about this, most of the recovery centers are called Turning Point, right, in the state?
Most of them, but not all.
But not all. And that's an old idea that, you know, here's a turning point in your life, if you will, right? I mean, is that the idea that this is a place where you're going to make a difference, you're going to go in a different direction?
Yes, there's a phrase in the book, Alcoholics Anonymous, we stood at the turning point, and that was the derivation of that name, and it was an AA club's name. And the AA club decided that they would morph themselves into being a recovery center that was there for people no matter how they looked at recovery.
Now, how long ago did that occur?
In 2001, a man from White River, Mark Helliges, had the idea that maybe he could morph the AA club that he was the manager of into something that was a broader way for people to get better. And he started talking to then Senator Leddy from Chittenden County, who at one point had been the state addiction agency's head. Just by happenstance, the two of them met each other in an airport far away. And the idea of creating some safe places for people to redefine themselves as being people in recovery was created. It's ironic because from that beginning of just trying to create safe places for people, we're now at the point where people at the Office of National Drug Control Policy at the federal level are looking at how do we create recovery services. The head of CSAT, the Center for Substance Abuse Treatment, is talking about how do we have recovery systems. And we didn't really set out to create a recovery system here in Vermont, but we happen to have the most advanced one in the country just by dumb luck and a tailwind.
Well, a lot of this seems like it's learning as you go, too. I mean, it looks like, you know, and the same time that's happening, you know, we had the explosion of the opiate epidemic in Vermont. And we've always had an alcohol problem in Vermont, and it's there. And we have people struggling with dual disorders. And we've always looked for, you know, where do you send people? Where can they go? Where can they learn about their disease? Where can they get help? And it really seems like that's like a place that's happening now. I know here in Brattleboro we have the Turning Point, and it was downtown, and then it went up to Putney Road, and now it's going back downtown to Flat Street, right? And they're trying to make that happen. And I think that's really exciting, to have a place for recovery, have a place where people can go and find out information, get services, talk to other people in recovery. I'm really excited about that. I think it's a good thing, quite frankly.
Yeah, I think you mentioned a couple of things that caught my attention, Robert. And one, you mentioned there being a difference between treatment and recovery. And the idea of how much time is spent maybe in treatment, whether it's an hour a day in a group or seeing a therapist, going to a 12-step meeting. There are all these other hours along the way here. And I think that's, at least I've worked with the folks in Bennington at the Turning Point there to try to find some way for us to work together with Suboxone practice and the recovery coaches. And that's one of the major pieces, is how do you really build a new community, and how do you kind of fill your day then with more sort of recovery-oriented settings and people.
Right.
Early recovery is so hard for people. If you think about it, you're reinventing yourself as somebody that doesn't do what you've always done every day. So finding people that are allies that can help support you in that is critical. And one of the things that I'm seeing and I'm more and more impressed by about peer recovery is that if I see you not using drugs and alcohol and happy, I think, well, maybe I could do that. Mm-hmm. But it takes role modeling. There's something that's really profoundly powerful about the role modeling of somebody else that's gotten better, that's laughing. Laughter is not something you hear early in your treatment program, I don't think.
No, no.
But later on, it starts to come, and it's really one of the signs of recovery.
And a sense of feeling good about yourself. I mean, I think that's the other piece. And among peers, it's just and you were saying, like, when someone gets into recovery, and I like this idea that people will begin to associate, and I think within each community, there's 11 recovery centers in the state of Vermont, right? Is that right?
Yeah.
And I almost would like people in the communities to think about that there is a place that needs their support. There is a place in their town that needs financial support, volunteer support, and it's really good stuff. I mean, it's sort of like, you might invest thousands of dollars treating somebody in a hospital. I mean, quite literally. And then when they leave, there's nothing there's minimum services. I won't say nothing, there is services, but maybe there's minimum services. And it's almost like, well, why don't we protect that investment? Why don't we put a little bit more money into what's available after you leave this highly structured treatment center, or even outpatient treatment sometimes. They can be very comprehensive, take up your whole day, multiple groups and meetings and everything, which is all valid. I mean, you want to have that introduction to recovery idea. But then you want something next. You want, like, other places and other recovery centers to go. And I really think that's one of the roles that they can serve in our community, is that idea that there is a place for people to go, family members to go, people to find out about the disease, people to help out each other. Anyway, so I hope that's working on some level. I mean, I hope that's what's happening.
Yeah, I mean, because most of us kind of find ourselves sort of evolved into a community, whether it's where we lived and people we grew up with, we went from, say, school to work, and people decide they're going to get involved with recovery and leaving their addiction or improving their mental health, often find themselves as if they're sort of a visitor to a new country or a new city where all of a sudden, wow, I've left behind or want to leave behind all the people that have been part of my pack and part of my social circle. And that's, that's a very difficult thing to sort of start over, rebuilding your community. And people struggle with that. And that's one of the points that's come out from the research of part of the effectiveness of AA, for example, is that you're in a community of people who encourages not drinking, as opposed to the community you came from, which is one that was encouraging drinking. So I think in that way, it serves a very important piece, because we haven't had a very broad spectrum, right? You're in treatment, you're out on the streets, you're in your home, and there's not been a very sort of fullness to the spaces in between there. And I think that's what I'm excited about with the Turning Points, is they start to offer that.
We've been working in the centers at trying to create recovery coaching as a model service that's delivered in the centers. And the basic premise is that somebody that's got some experience in recovery and has been trained in asking questions, not providing any guidance per se, but helping people think about what the next right thing they need to do in their lives are, the things that will make their lives more full. And the progress we've made with developing a recovery coaching program at every center around the state has been amazing. We did an outcome study on what happened to people 3 months down the road that were involved in recovery coaching and found that there was literally statistically significant reductions in their use of courts, emergency rooms, corrections, detoxes. And those are things you'd expect when somebody gets in recovery and stays in recovery. Now, of course, these are relapsing conditions, so people do sometimes stop. But the results of the recovery coaching were really positive in that there was significant changes in people's lives not using these expensive other services. And that goes to what you were just talking of, Robert, because it's a way to help rebuild people's lives, put them back on being a productive part of society versus a drain on society.
Right.
Yeah.
The other thing I noticed, and if you don't mind, I know I'm talking a lot, but when I was on the website, one of the things I saw that there was the services there for family. And you know, I was so encouraged by that because a lot of families are affected by substance abuse and mental illness. I mean, it's you know, and a lot of times when I used to do a family weekend, I used to do a family education day. And one of the things I come to appreciate is it's for so many family members, while their loved one is getting high and using, they're really isolated. It's the shame of the addiction that isolates them. It's the I don't know what to do. There's the frustration of like trying to make it better. And the idea that there's these ongoing groups that maybe there could be a help to families and people who are suffering with someone who's still using. Maybe they're not ready to use. And I don't know if this is I just want to say from my experience, when the family gets really sick, it gets affected. It's a family illness. And when the family becomes, and people hate the word, but it's true, dysfunctional, the family gets in this pattern of behavior almost, if you will. And it's really hard to break it out. I mean, I had to stop it. And I used to tell people, it's so important for the family to get healthy. I mean, it's almost as if someone is sick and they're addicted, and they stay in an addicted family, and it all seems to work almost. I mean, and yet if you can begin to get the family healthy and get them services and get them to understand, you know, what's going on and what the struggle is about, a lot of times that can sort of move a person, a loved one, from pre-contemplation into contemplation, or maybe even move them into readiness. You know, like, gee, what should I do? I know I've done wrong. Now what should I do? And to have somebody in your family to say, well, here's this and here's that. Here's some recommendations. I went to the recovery, the turning point, and they suggested this or that. So I'm really, that's another piece, because one of the problems we used to have where I worked was that family members often weren't covered by insurance. I mean, it was, you know what I mean? Like, you know, and it was hard to offer them services just because their loved one was an addict or an alcoholic. I mean, I suppose you could find a mental health diagnosis or something, but it really wasn't structured that way per se. They get, and I like this idea that maybe there could develop some support groups within the turning points for family members who are affected by alcoholism or drug addiction. I mean,
There's been a tremendous number of people that have walked through the doors of recovery centers trying to help loved ones. And last year I bought all the recovery centers this book that was, Vernon Johnson was the person that developed interventions. And he wrote a little book called Intervention, How to Help Somebody That Doesn't Want Help, which is a wonderful how-to manual for getting a loved one sober. And I provided it to all the recovery centers and spent some time talking with center directors so they could share the information with others in the centers. But one of the most powerful things for somebody that's a family member to know about addictions is that the person who's suffering doesn't necessarily know what's going on, and clear, value-neutral statements about, gee, when you drove home last night and we were on the road for half the way on the wrong side of the road, I was scared to death. The person operating doesn't remember that, doesn't know that. And if the information comes in a value-neutral way, it gives them a chance to start to piece together that maybe they need to do something.
and that's something that you learn, right? And by saying that, you mean non-judgmental, like not calling them names and this and that and yelling at them, but giving them the facts. This is what's happened, or this is what's going on.
And the biggest challenge for people that are in trouble with addictions is that they don't know. I think that both of you are treatment professionals, and I think you'd agree that everybody that starts a recovery process or a treatment process has a totally unrealistic view of how well they're doing. They think they're doing much better than they are.
Well, I think this, one of the ways of describing the earlier stages of pre-contemplation is that in plain English means, I don't got a problem, you got a problem.
Yeah.
Right? So to back off, which clearly says they're not ready, but keeping that relationship going is really important. And most families, as much as they're craving knowing what to do, and this is a great way to arm them by sort of, you know, bringing everybody in and treating more than just, say, the one individual who seems to be have the problem.
Families are often in the action stage for recovery. They want something done. They want, you know, and the person they love is often, like you were saying, they're like still getting high, you know, this is not a problem. And I think one of the things that it's hard for family members sometimes to accept is that it isn't about getting their loved one well. It's about helping them to get well. And as they get well, they will begin to influence. They will begin. See, it's dangerous because family members don't like to hear this idea that they might be sick, and I don't want to go there. But I mean, they can learn words and techniques and stuff and reinforce their own sense of, not their sense of powerlessness per se, but their sense of like, I need to fix this, or I need to hide this, or I need to, you know, cover or protect them. Instead, sort of say, no, there's another way to do this. There's another way to engage them, and not to engage in their illness, but to engage in them in their recovery. So I guess what I'm trying to say is that I think in some cases the family can begin their recovery before their loved one begins recovery. But in the process of doing that, they will help assist that person get there sooner. I mean, that's my hope anyway.
I really agree. One of the things that Vernon Johnson, he was an amazing man. It's too bad he's gone. But one of the things he did is he helped introduce people to the idea that the family member that had an addiction problem didn't have clarity about what was going on, and that they really didn't know how badly things were going. And if a family member knows that, it changes the nature of the conversation, because many family members think, well, why am I being the bad guy here? I'm not the one that was stumbling around the house. Yeah. There's this dynamic that happens where the people that are in trouble, they don't have any clear idea about what's going on in their lives. So having a family member get some clarity about, oh, they don't know.
Right.
That's really important for them. It's very empowering.
Yeah, and one of the things about sort of family theory is that there's this dynamic, and I use the term drama, just sort of in the stage sense, that everybody has a role that they play, and these roles put together that make the production. And many families don't sort of recognize the role that each of them is playing. And what a lot of addicts struggle with when they first come into treatment is they're trying to change their role, and the family and their community is not ready to change their role, so they keep kind of getting pulled back in to keep on playing the same role. So if you get a family then that starts to acknowledge that the roles, the positions they've been playing, and they start to change that, then of course that leads to a little push then that then the person struggling with addiction has to begin to kind of reevaluate what their role is and what their interplay is going to be in this production.
One of the things that I had you on, and as you know, a lot of people, we hope, see this program throughout the state. How do people find their local turning point? How do they get information? Where do they find it? And what are some of your hopes or plans, if you will, for the future? What are you looking at?
Well, the answer to the first question is, the most amazing resource we have in Vermont is this 211 phone line. They know everything about everywhere. It's truly amazing.
And that just dial 211?
Just dial 211, and they'll tell you who's a counselor in East Middlebury, if there is one. But it's truly phenomenal. And the recovery centers owe a huge debt of gratitude to that 211 line, because that's a place that a lot of people end up finding out about a recovery center from when they call saying, I don't know what to do. One of the benefits of a recovery center is, unlike seeing somebody in a clinical setting, you can walk in when the center's open. You don't have to have an appointment. And that's, for most people that are beginning their recovery process, not something they're about to do. People that enter recovery are ready for recovery at 10 o'clock on Tuesday, and at 2, never mind. And so having a center that's open to have people get a chance to interrupt their addictions is really important. The question you asked, which is wonderful, about where we think we're going and where we hope to go, is that we started out trying to figure out how you support somebody on all paths to recovery. We started out discovering that we needed to use language that was different. We don't refer to anybody that comes to a recovery center as a client. They're people in recovery, visitors, guests. But the idea is to make it a level playing field between whoever's working with a visitor and the visitor. The idea of making that menu of options at a recovery center much broader is really important. The centers, many of them now are running groups that are called Making Recovery Easier, and they were adopted and adapted from a model developed in California by a woman named Lika Skoudas, and it was to introduce people to 12-step recovery. One of the things we discovered is that many people come to the recovery centers having formed what they believe is an idea of exactly how 12-step recovery works. But their information comes from other people that they met at the bar, that don't have a clear idea, that may have gone to a meeting once but didn't quite understand what was happening. And so by having a group that people can go to and be introduced to what does it mean to be in recovery has been really powerful. These things are 6 sessions of an hour and a half long each, and they're facilitated by somebody that understands being in recovery and dispels a lot of the myths of recovery. So having that kind of a structured service for people that are trying to maintain recovery either without treatment or to maintain their recovery and not go back to treatment. So many people do multiple episodes of treatment that it's a real blessing if you can keep them just from returning to active use. So having a menu, a broader, increasingly broader menu of services that support people has been really important. We've been starting to run what are called all recovery meetings, and they're meetings that are not AA, they're not NA, they're open. One of the reasons we've found them so important is that Nels's patients that are being prescribed buprenorphine are not necessarily going to be welcomed in a Narcotics Anonymous meeting where abstinence is the basis of recovery.
Don't say anything about it when you first go in. That's the word on the streets.
But if you have an all-recovery meeting where somebody is welcome no matter how their path to recovery works, all of a sudden they're somewhere they're welcome. They can find other people they can identify with. And your comments before about how do you redefine yourself as a person in recovery, you got to have a space to do that in. So broadening the level of support to do that and increasing, centers don't have much in the way of staff at all. They're three-quarter-time directors, some part-time people in some centers. The idea of having some people that have some real experience in facilitating Making Recovery Easier groups, or running an all-recovery meeting, or supporting people with Making Change, which is a young person's program that helps young people explore the idea that they might want to be in recovery. Having a whole series of people that are experienced with recovery work that can help introduce others to the concepts of recovery is a goal. Now, who knows where we'll get? The governor, luckily, has put a little bit of money into this year's budget to help recovery centers an increase, which is a blessing, for which we're very grateful.
Now, do you want to mention the website just one more time before we close?
Vermont Recovery Network, vtrecoverynetwork.org.
One word, continuous.
Continuous. Explore it. I think you'll find interesting things there.
And 211.
211 is a great way to find anything, not just a recovery center.
Okay.
Yeah. Oh, this is great. Much fuller spectrum, not these sort of big resource-intensive hits of treatment, but more akin with day-to-day life, right? And getting by a day at a time, right?
I think that's it.
Well, I've been really glad to have you here, and I'm glad you came in on the show to talk about recovery. And as you know, if we can do something to be helpful to you guys, we'd like to do it.
These guys have been really, really helpful for the recovery centers.
No, really.
Well,
thank you.
It's all good work. Yeah. Mark, thank you.
Thank you.
Thank you.
Well,
Now you got to do exaggerated.
Yeah, like Monty Python, like 1, 2, 3. Yeah. School
Oh,
of silly walks, Now you get it, and then we'll go the other way. School of silly walks. Yeah. You got it.